Doctor, you have just did an ultrasound for me. Why did you do it? And what information did you obtain by doing the ultrasound?
Ultrasound is a wonderful tool and it does not have any harmful effects for women. Lot of people think ultrasound is harmful, but the answer is X-rays are harmful. Ultrasound is absolutely safe and it can be done any number of times and there is no harmful effect to the woman. So the first and foremost thing is ultrasound is a safe test which does not carry any risk for your health. The second thing is, in this ultrasound, what is assessed is, one is the female reproductive tract can be imaged in 2 dimension, 3 dimension and 4 dimension. What information I get is, one is size of the uterus, second is size of the lining and the thickness of the lining, the third is whether there are any abnormalities which are there from the birth called congenital anomalies of the uterus. The fourth aspect is, are there any tumors growing in your uterus, be it fibroids or adenomyosis. The fifth is the bed where the baby grows is normal or abnormal. These are the information is obtained in ultrasound. And adjacent to the ultrasound are the 2 ovaries which are vital for the female reproductive tract. In the ovaries, we see whether the ovary size is appropriate to your age. The reason why we see the size is, women are born with a fixed number of eggs and these eggs start growing and developing from the time you have first menstrual period, and when they get exhausted at the age of 40 to 50 years, then it is called menopause. Ultrasound helps us to see the size of the ovary in relation to the age, whether it is normal or abnormal. If it is abnormal, what type of abnormality? The other aspect is if the ovary contains any cysts or tumors. Lot of times a woman is diagnosed with polycystic ovary and then somebody says PCO or cysts in the ovary, but lot of times a mistaken diagnosis is made. A polycystic ovary should contain 3 parameters. One is the woman should have irregular cycles, the ovary size should be significantly larger, and third is the number of cysts or follicles should be at least 15 to 20 per each ovary. Then only we say it's a polycystic ovary. Plus the woman should have signs of androgen excess, which is the pimples or the excessive hair. Just because by ultrasound the ovaries are larger, it does not mean polycystic ovary. So we rule out presence or absence of polycystic ovary. Then we rule out whether the woman's ovaries are appropriate to the age or they are decreased in size. If they are decreased in size, then there is an urgency, they should get the pregnancy early and they should not postpone pregnancy. The other thing is presence of a cyst, which is a functional cyst which does not harm the reproductive tract and can be left alone. Sometimes the presence of a cyst called endometriosis, wherein it might need surgery, it might need hastening up of the pregnancy, sometimes it might need assisted reproduction, also known as IVF. This is the information I get when I do an ultrasound. That means I get information about the uterus, I get information about the ovary in relation to their function and abnormalities. By using 3D technology, I'll be able to look at the uterus and the ovaries in 3 dimensions, so I get much more better information. And in 4 dimension, I get further much more clarity about the individual pathology. Here I want to add one thing. Krishna IVF is working with Samsung for the past 5 years and developed certain technologies using artificial intelligence. And one of the development that has happened at Krishna IVF is launched as a product in the Samsung Ultrasound as 5D follicle. And on that topic, we had a scientific publication also. And Samsung had also got a patent. In the area of uterus, using artificial intelligence, we also worked with Samsung for a future application called junctional zone, which will be coming in 2023 or 2024 machines, where we are trying to assess the lining as throughout the cycle and use it as a predictor for treatment successes also. So in short, we do an ultrasound to know the health of the uterus and health of the ovary, and if it is abnormality is picked up, it is picked up in the first visit within couple of hours of your first visit, so that we have a huge lot of information.